We begin this next section of the textbook with a concept called homeostasis. Homeostasis is the property of an organism to maintain a stable internal environment. It was first described in the mid-19th century, but there was a very interesting experiment performed by a physician, a British physician, Charles Blagden, in 1775. Charles Blagden lighted up a specially prepared room until everything inside was warm. Then, together with several of his associates, a dog and a beefsteak, they walked in. The researchers sweated. The dog panted as the temperature inside the room, or oven as you like to call it, gradually rose until it reached as high as 127 degrees Celsius. That's 260 Fahrenheit. 45 minutes later, the beefsteak, which is lifeless and therefore cannot maintain homeostasis, was completely cooked, but the dog and all the human participants walked out of the room and survived. But who ate the beefsteak? When we talk about homeostasis, we often use the analogy of a home heating system. So in your home, you have a thermometer that detects the temperature. You have a thermostat which analyzes the temperature and decides what to do, whether to cool the room or warm the room. And then you have an effector which will cool the room or warm the room. So we'll be talking in this case about an air conditioning unit. So in the summertime, maybe you keep your home at 70, let's say 70, and normally it's not going to stay right at 70. It might fluctuate between 69 and 72. But as the temperature rises and the receptor or thermometer detects that change, that information is sent to the control center, in this case the thermostat. The thermostat will then send commands to the effector or air conditioner, which turns on, and the room temperature will drop. Homeostasis means maintaining a normal range. Control of room temperature, just like the control of the body temperature, is not precise. That temperature is maintained in a normal range around a set point. And in this case, the set point is 22 degrees Celsius. And you can see if the temperature dips below that, you're okay. But if it dips above that, the air conditioner turns on, and so on. So the set point at 22 is just the goal, but the temperature will always fluctuate within a specific range. Now, the method of this control is called negative feedback. Feedback is the stimulation of a receptor, is when a receptor is stimulated and it triggers a response that changes the environment. Well, in negative feedback, which is the most common method of control in the body, the effector opposes the original stimulus. So if the room temperature gets too hot during negative feedback, the air conditioner will kick in and cool the room down. Just as if your body gets too hot, the temperature will have to cool down to maintain homeostasis. Negative feedback minimizes change. It is the most common mechanism of homeostatic regulation in the body, and it provides a long-term control over the body's internal conditions and systems. It's a dynamic process. It's not set in stone. There's change about that set point. So in the body, homeostasis is disturbed. And let's say the receptors in the skin, the temperature receptors in the skin, notice that the body's getting warm. So it sends that information to the control center, the brain. And then the brain is going to send its information to the muscles and glands. In this case, if you're getting too warm, you are going to increase the size of your capillaries going to your skin so that more blood can flow out and we release heat through our skin that way. We will also increase the action of our sweat glands to release heat in that way. There's another method control homeostasis, and that is positive feedback. Positive feedback is when a response exaggerates the original change. It's an escalating cycle, and it's something that kind of grows and grows and grows until the effect is met, and then it's over. This is found in the body when dangerous or stressful processes have got to be completed quickly. It does not help maintain homeostasis. So a good example is blood clotting. The immediate danger to address is preventing blood loss so you don't die. And it must be done very, very quickly. And so the stimulus, after the process is completed, the stimulus for positive feedback loop stops, and the blood clotting procedure will stop. So here's what happens. You have a cut, a break in a blood vessel wall causing bleeding. Damage to the cells in the blood vessel release chemicals, and these chemicals help begin the process of blood clotting. The chemicals start a chain reaction. Cells, cell fragments, and proteins in the blood begin to form a clot. As the clotting continues, each step releases chemicals that keeps the clotting process going. This is an escalating process. It is positive feedback that ends with the formation of a blood clot so that you don't die of blood loss. Another example of positive feedback loop is childbirth. As a woman's oxytocin rises, her uterus contracts. When the uterus contracts, it causes the release of more oxytocin, which causes the uterus to contract even more. And this is an escalating cycle that ends in the birth of the child. There are some terms that you will find in anatomy that are very strange. Some of them are based on Latin or Greek. You will get used to these strange terms. I suggest you try to say them out loud. It doesn't matter if you say them correctly or incorrectly. There are multiple ways to say many terms. You will become comfortable with a lot of the prefixes and suffixes used in anatomy. You will notice that some of them are named after a person. Those are called eponyms. And you will learn a lot of the root words, which will help you understand other topics. Do not memorize this chart. Just look through it. You can pause the video here and look at it. You may realize that bio means life. Cardia refers to the heart. Chondro refers to cartilage, and so on. These are all very, very useful words. Some you'll see over and over again, like hypo and hyper. You will see peri a lot. Peri means around. Anatomical position is a particular position of the body. The hands are at the side. You're just looking forward. Your feet are together, facing forward, and your palms are facing forward. A supine position is lying face up, and a prone position is lying face down. This is Mr. Man. He's got a lot of terms here. We do not need to know all of these terms. You will be using some over and over again in this class, such as cranial, oral, facial, nasal, axillary, brachial. So I would look through these terms and get to know as many as you can. And here is the back half. The human body can be subdivided in various ways in terms of talking about one body part relative to another body part. And what we do when we look at the abdominal region is we can separate it into 4 quadrants. Those quadrants intersect at the belly button. And so you need to understand that it is always the patient's right and left. So this area refers to the right upper quadrant. This area is the left upper quadrant, and so on. This abdominal region can also be separated into 9 abdominopelvic regions. These terms, well, you may know that gastric refers to stomach. Hypo is a prefix that means below, and epi is a prefix that means on top of. So the stomach is right around here. So we have on top of the stomach and below the stomach. The belly button area is umbilical. The inguinal area is this crease between the torso and the thigh. So this is the inguinal region, sometimes called iliac region. This part corresponds to the lower vertebrae of the spinal column, and those are the lumbar vertebrae. So this is the lumbar region. And then above here, the ribs are covered with cartilage. And this region is the hypo, or below the cartilage region. The reason we have these subdivisions is so you can locate particular organs. You are not expected to memorize where organs are located, but you should be aware. So look here at the urinary bladder here. This is in the hypogastric region, if we're talking about the 9 regions, but it's in the right lower quadrant and the left lower quadrant when we're talking about the quadrants. It shares those quadrants. So organs are in different quadrants and different regions. Directional terms are important. It is comparing one body part to another body part in terms of where it is on the body. Some terms are used interchangeably. Anterior means ventral, posterior means dorsal. Cranial means toward the head, caudal means toward the feet, lateral means toward the side, medial means toward the midline, proximal means toward the trunk, distal means away from the trunk. And this chart gives you an example of using each one of these words. Sectional planes are important because of many of the pictures in the book that you will see are planes, and they show you the body part from different aspects. So if you had a plane through the body that was horizontal, that would be a transverse plane. This green plane here is a transverse plane. If you had a plane that divided the body between left and right, that would be sagittal. This is right down the center, so it's mid-sagittal. If you had a plane that separated the front from the back, you would have a frontal plane or coronal plane. Again, these are just definitions of each of those planes. So, do you remember the planes? If you were to cut this potato straight down through the middle, what type of plane is that? Here we'd be separating the front of the potato from the back of the potato. That would be a frontal or coronal plane. This plane here that separates the top of the potato from the bottom of the potato is a transverse plane. And this plane here is not dead center, but it's separating the potato from the left side and the right side. So this would be a parasagittal plane. Body cavities are a little bit difficult only because we get into membranes, and the membranes seem to be hard to remember. The interior of the body is subdivided into body cavities, and there's 2 functions of these cavities. These cavities protect from shocks and impacts, and these cavities allow changes in the size and shape of internal organs.